Okay.
Good evening, everybody. I'm going to call the meeting to order and begin by reading the notice. Board of Alders of New Haven notice. The Health and Human Services Committee will meet in person on Thursday, January 23rd, 2025 at 6:30 p.m. in the Board of Alders Chamber, 165 Church Street, 2nd floor, New Haven, Connecticut, to act on the following item. LM-2024-0755, order authorizing the mayor of the city of New Haven to apply for and accept grant funding from the U.S. Substance Abuse and Mental Health Services Administration Children's Mental Health Initiative to fund a system of care for youth experiencing serious emotional disturbances and at risk for developing psychosis, and execute all documents and contracts as necessary in partnership with the Prime Psychosis Risk Clinic at Yale University. This item is on file, available for public inspection in the Office of Legislative Services, 165 Church Street, New Haven. Per order, Honorable Eli Saban, Chair. Attest, Honorable Michael Smart, City Clerk. If you need an accessibility-related accommodation, please contact 203-946-7651 or 203-946-8582. In accordance with the City of New Haven COVID-19 policies, masks are now optional. Public may send comments to public testimony at newhavenct.gov. My name is Eli Saban. I represent Ward 7 on the Board of Alders, and I'm the chair of this committee. And I will invite my colleagues to introduce themselves, starting with my vice chair.
Sarah Miller, Ward 14.
Going that way.
Caroline Tomby-Smith, Ward 9. Teresa Marie, Ward 12.
Kempton Singh, Ward 5.
Thanks for joining us, colleagues. We will now hear from our presenters. Please come forward and give us your names and addresses for record.
Thank you. Loretta Mitchell, 107 Foster Street, New Haven. I'm the coordinator for mental health initiatives here at the city.
Emily Farina, at 424 Highland Street in Weathersfield.
And with Al Peppers, I'm at 9 St. Jordan Terrace, and I'm the associate director of the private location.
So we are here tonight to seek approval to apply for grant funding. The name of the grant is lengthy. It's also known as the Children's Mental Health Initiative. It is a SAMHSA, Substance Abuse and Mental Health Services federal grant. Next slide, please. So this is a federal grant opportunity with the purpose to fund a system of care approach, which is creating sustainable infrastructure and services, particularly for youth at risk for or having serious emotional disturbances and the family of those youth. Eligibility for this grant is limited to government agencies, which is why the city is the applicant of this grant. And the anticipated award amount is up to $1 million per year for up to 4 years. As some background, young people at clinical high risk for psychosis constitute a population in particular need of recognition, in need of clinical services and community supports. There's an estimated 2,500 young people in New Haven, that's 10 to 21, who in the greater New Haven area who may be at clinical high risk for psychosis and who would therefore benefit from these grant activities. Importantly, about this population, we know that delayed care or lack of care really affects long-term quality of life and functioning. So in our city, when we think about residents who maybe are experiencing some of the most acute mental health symptoms, residents who experience some of the worst stigma related to mental health, and residents who experience some of the poorest outcomes related to their mental health condition. These people may have psychosis, may have a diagnosis of schizophrenia or another psychotic condition. And what we know about these residents is likely they didn't receive early screening, early intervention, or early treatment. And so as framing for this grant, we're really thinking about reaching people early so that we do not see worse outcomes in the long run that we know impact our communities today. And what this grant is really supporting is early intervention, and early intervention has been shown to reduce adverse outcomes long term. I think importantly to note about New Haven as well, we're a very diverse city. And so when we think about our young people who may be at clinical high risk for psychosis, those young people, Black and Brown youth in particular, low income youth, they're more likely to end up in treatment or sort of enter care through aversive pathways. So through forced hospitalization, through the criminal legal system, through punitive actions in school. And that's just not really a good way to enter the mental health care system. So that's some background about the need in our community. I'm going to ask my partners to chime in just if there's anything else they want to say. But what I want to say, and I'll let them introduce themselves, we're really lucky in New Haven to have actually some national experts when it comes to early intervention in psychosis. And so I feel extremely grateful and privileged to be partnering with them on this grant.
As I mentioned before, so we're from the Prime Clinic through the Yale School of Medicine. So the Prime Clinic is the longest running clinic in North America to focus on young people at clinical high risk for psychosis. In fact, doctors at the Prime Clinic wrote the evaluation that helps us detect whether someone's experiencing these kinds of symptoms. We've been in operation since 1996, and we are operated through the Connecticut Mental Health Center, CMHC, as well as the Yale School of Medicine. I'm a clinical psychologist at the Prime Clinic, and this is our medical director and associate director. At the clinic, we provide specialized evaluation, treatment, and support to youth at clinical high risk for psychosis. We also provide support to their families to help those young people improve their functioning, reduce their symptoms. Ideally, we would like to delay or prevent the onset of psychosis if it's going to occur. And at the very least, help those young people experience or reduce those symptoms that they're already experiencing, even prior to the onset of something like a psychotic disorder. The Prime Clinic has a long history of kind of writing grants, receiving grants. We have a history of 2 SAMHSA grant awards in particular in partnership with DMIS, and then also a long history of NIH grants, and have really shown responsible grant funding stewardship. So what we are aiming to do as a part of this, what we're proposing in this grant, is that we create what we're calling the Prime Network, or a system of care for youth at clinical high risk for psychosis. So in this, we want to establish a comprehensive, community-based system of care for youth at clinical high risk in the greater New Haven area, really focusing on New Haven proper. So this would involve a few different things. So one is an initial community needs assessment, where we would use things like focus groups and going out and doing qualitative interviewing with people in the community from different groups to really kind of find out what are the needs of the community that we can use these funds to help provide supports in that community. And we will also develop a community advisory board, which will be used to guide and direct project implementation. This will be a mix of, we hope both clinical and non-clinical leadership. For example, people from faith-based organizations, youth and parents, school system leadership that can come and really steer the project. We then plan to expand the current services that the Prime Clinic are offering to deliver care in community-based clinics throughout the area. So we're currently hoping to, we have developed partnerships with 7 clinics in the New Haven area who provide mental health services, who have committed to allowing the Prime Clinic to come in and do screening at intake for all of their new clients, and then to receive training and consultation from the Prime Clinic as well. And then we aim to create this coordinated network through this training, consultation, and screening initiative of these clinical partners in the New Haven area to provide all of these tools and services. And then additionally, after young people are identified as being at clinical high risk for psychosis through this network, we then aim to provide evidence-based treatment options for those young people at each of these clinic sites. So really allowing young people to receive care at the clinic, at their kind of home clinic where they feel most comfortable and can stay long-term, rather than having to come separately to us at Yale to receive services somewhere where they may not even feel comfortable. And then finally, we also want to develop non-clinical partnerships, which I mentioned, so that we can educate the community and young people directly about mental health and psychosis risk, and try to get those young people who will not be help seeking initially, to help them understand why maybe they might want to seek care, or what they can do in the meantime if they choose not to seek care.
I would just add on that last point about the sort of community outreach. As I was saying before, I think psychosis is really one of the most stigmatized conditions when it comes to mental health, and we know many people themselves or their family members may feel shame when it comes to seeking care. And so that community piece is really important to share information about psychosis, let people know that treatment is available and that it works, and making those connections with community partners who are trusted messengers. And that's a big part of the grant funding or the grant activities. Anything else you need to add?
No, I would say, just to kind of highlight a little bit of what Dr. Freeman mentioned earlier, and this is work that is based on now decades of evidence that intervening early is the best thing to do for these young people who are not just at risk of psychosis, but people who develop a first episode of psychosis. And that evidence is based on intervening within 5 years of psychosis onset. What we're talking about here is identifying before psychosis even happens, the people who are at risk, and then to offer services before then. Which, ideally, if we do catch the onset of psychosis, we'll catch it at day 0. And so the goal here would be really to offer as much of a chance for people to be able to live their lives as they otherwise would, and to provide as many services as possible with a rapport that has been established even before the onset of actual frank illness. So this is cutting edge in a scientific way, and as well as the ability to reach a large number of youth in our area.
What you see here is a visual description of that system of care. So we have the City of New Haven in partnership with the Prime Clinic, and really having this project steered by a community advisory board made up of people from kind of all parts of this system of care. And then we've got non-clinical partners who would include faith-based organizations, which is where many of the youth in the city do show when they start to show some of these symptoms, youth and families, as well as schools. And then the clinical partners, including the Prime Clinic and those clinics that have agreed to come on board with us.
So briefly related to the budget, it's still in final development, but as I said, we're eligible to apply for funds up to $1 million per year, renewing up to 4 years. And if awarded, the City of New Haven will accept the funds and create a project director position, and then grant funds would be further distributed through a contract with the Prime Clinic, who would then further subcontract with local mental health facilities. Additionally, funds will support the hiring of a lead family coordinator. So this is a family member, someone with lived experience who has a family member with psychosis, and they would be essential to the project planning and implementation as well. So that concludes our presentation. We're happy to answer any questions.
Thank you so much for being here and for your presentation. I think we might have some questions. Colleagues?
Thank you for the information. I was just wondering, so if you could tell us, like, in what ways is this an expansion of your work, or is this a new components of the work? I mean, it sounds like you're doing a lot of this already, and what of these partnerships are already developed and which will be new?
Yeah, absolutely. So we've been providing clinical care directly at our clinic when people have come to us at the Connecticut Mental Health Centers since 2018, funded through other SAMHSA grants. And so we've been doing this work and providing the direct care to somewhere around 30 young people per year. And so then in the last couple of years, we actually started a partnership with 3 other local psychiatric clinics, so Clifford Beers, BH Care, and Healthcare, where we've already started doing some of this screening. And we found that by implementing this screening, we are able to get more diverse youth into care with different kinds of sets of symptoms as well. So the screening has been pretty successful. We're sort of working through all the barriers to getting that screening implemented. And now this would allow us to continue that while also expanding to an additional 4 clinics.
We're only, we're spirited and energetic, but we can't serve all 2,500 people who are potentially high risk for developing psychosis in just our area. And this would be kind of multiplying those efforts to and establishing expertise within the local clinics already, so that ideally that would be perpetuated over many years to come as well.
Just one quick thought. So you go from 30 young people a year to what, approximately how many people?
So 30 served internally at Prime to around, currently we're screening, well, we would have the capacity to, so we wouldn't be providing direct care to anybody. So we would be, each of the clinics would be providing the direct care. So really anybody who's identified through their clinic, they would continue to provide that care. We estimate that somewhere around 2,500 young people in New Haven area will meet criteria for clinical high risk for psychosis. That doesn't mean all of them are help seeking, but we would have the potential to serve them through these clinics.
So through your universal screening effort already, people are screening positive at a rate of between 20 and 30%, I think.
Yes.
Which would then cause them to have a specialized evaluation to see whether they are in fact at high risk for developing psychosis, and then be able to offer services for that. And so the nice thing about doing it this way as well would be that they would be identified within their clinic. There's a lot of barriers like coming over to Yale, like getting an evaluation, and then accepting care over at our clinic as well. Those barriers would be removed at that point. So my hope would be that we would be able to enroll then fully in specialized care about that 25 to 30% potentially of people who are screening positive at intake at each of these constituent clinics, which is a lot of people. I think, and the intake numbers total depend on the individual clinics, but so it's hard to get that at full estimate.
Just one follow-up, if I may. So that's helpful. So in terms of the screening, that was my other question. So it's mostly going to happen in the partner clinics. Is there any screening in schools, or especially the school-based health centers and stuff like that, where it's much lower barrier and people are just right there?
Yes.
In case they don't have to drive anywhere.
So we are partnering with Clifford Beers, who I know does a lot of the school-based mental health work. We did have a meeting, and we're working on getting a connection with the New Haven public school system. What would make the most sense for our screener is to be implemented in or mental health care within the school system rather than broad-based screening. So if they were interested in that, we'd definitely be open to it, but we haven't.
We'd be happy to help you with that.
Great, perfect.
That's great.
Great.
Yes, certainly if the alders have ideas of other settings or constituencies where we can make connections, of course, we are certainly open to that input.
Okay, thank you.
Thank you. Thanks, Dr. Miller. Interesting.
Thank you, Mr. Chair. What age group you're looking to serve?
10 to 21.
And currently, what age group you're interacting with, you're seeing coming through the clinic you're serving?
Currently 12 to 25.
Thank you,
Yeah.
Mr. Chair.
Yeah.
Thanks, Dr.
Thank you, Mr. Chair. Thank you all so much for your presentation. Just a couple questions. Could you talk a little bit more about the training for clinicians at partner sites and just what that kind of capacity building looks like?
Yes, certainly. So we've already done initial trainings at each of the partner sites just to let them know about the kind of work that we do. So the next step would be once the project starts, is we would go out and do a second training to provide, because there's a bit of turnover at each of the sites as well. So we want to make sure at least twice a year that we go in, do a training on what the clinical high risk syndrome looks like. what the symptoms are that a clinician can recognize, and then also kind of basics on how to work with someone who is at clinical high risk for psychosis. Then we would offer an additional training covered by the grant, where we go in and teach any of the clinicians who are interested and have the capacity to take on clients, an evidence-informed psychoeducation approach that we're currently already using at Prime, which helps. It's a sort of a multi-session approach where clients come in, they work with the clinician to learn about like what these symptoms look like, and they learn about how to manage their symptoms. They do some safety planning, things like that. So we teach the clinicians all about how to do that. And then in addition to that, we wouldn't want to just train them and kind of leave them high and dry. So we have a follow-up plan for how to continue the training long-term with each of the clinicians, which is to have a consultation model based on the ECHO approach. So ECHO is kind of a medical, it sounds like you guys are familiar with it, but it's a medical model of providing consultation for kind of rare diseases or disorders. So we would host a monthly ECHO call where all providers who are within the network, or even providers who are not in the network, could learn brief didactics about what the clinical high-risk syndrome looks like. And then they could bring de-identified cases to really talk it out and continue learning actively throughout the course of the project.
That's really helpful. And would you say that it's reasonable to say that as a result of this grant, a young person who receives care at one of these partner sites would be able to now receive the same quality of care that they would if they were to enter into the Prime clinic? Would you say that's sort of the heartbeat of the grant?
That is what we're aiming. That's what we're aiming for. Yeah. So the clinicians would receive as much support as they need from us to make that happen. Mm-hmm. And if anything, I think what we've learned from talking with a lot of clients who do screen positive and who choose not to come to us, of which there is a high proportion, they choose to stay at their home clinics, is that they would feel more comfortable there, and they've already developed relationships with the clinicians in their community. So I imagine that not only would the quality of care not diminish, but they would feel like more comfortable being where they're at.
Really helpful. My only last question is just, has this been done in other communities, and if so, what have those results been?
Yes, so I know none in Connecticut. We have talked with another program that is also funded through SAMHSA in California, who's done something similar like this. My understanding is the mental health care system is a bit different in California, but they've been able to teach us lots of things about kind of barriers that they've faced. And they've been successful in doing clinics, providing trainings, all of that kind of stuff. Yeah,
one of the nice things about this initial grant, the SAMHSA grant that we got in 2018, is that it does establish this network of different clinics that are funded by the same mechanism. And there are regular kind of catch-ups, and we can actually learn from each other's experience that way. So it's we have been touching base with them as we're trying to do something.
Thank you, Mr. Chair.
Thank you, Elizabeth. I have a couple of sort of logistical questions. I was wondering, the max grant amount is $1 million for 4 years. Are we applying for that grant amount? Is there a possibility that we might receive less than that, and how would that affect sort of the program?
so we're applying for close to that amount. I would say currently the budget's estimated at a little bit over 900. I do not believe, I think if we apply and it's funded, we would receive the full amount. I do not believe that they would change.
They haven't in the past, at least.
Yeah.
Thank you. And then it sounds like the answer to this is no. We haven't put in an application for this type of program before, not specifically.
No.
Understood. And I was also wondering, the project director position the city would be hiring, would that be a temporary position or funded by the grant, or a permanent position? How is that?
Yes, it would be temporary to manage grant activities.
Got it. Thank you. And then the last thing I was wondering, sort of following up our brief exchange about public schools, I'd be interested if you have thoughts. We can talk more after the meeting as well, but about what kind of engagement along those lines you think could be valuable as part of this project, if you have any thoughts at the moment.
Yeah, engaging with the public schools.
Yes.
And not just training, around other ways, outreach.
Yeah, I think screening within schools or outreach, all of the above.
Yep, absolutely. So we've already started attending the
New Haven Prevention Council.
New Haven Prevention Council. I can never remember acronyms. So trying to work with them and going to their events. And then I know Lorena's also helped us connect with some of the other youth programming too. So we've been thinking about like how can we get in there and do outreach to teach the young people about, you know, improve mental health literacy, understanding and comfort talking about mental health, having those kinds of discussions. In the actual school systems, I think a couple of things that we could do is screening in the school-based mental health clinics, and then having presentations to school staff. So we frequently do presentations around the state of Connecticut to social workers, school administration, and also teachers on like how to recognize the signs in the classroom that a young person may be showing. We actually don't do many in New Haven, and that's not, you know, we would like to do more of them, so it'd be great.
I would also add, you know, part of the project is to have the lead family coordinator, so that person hopefully would help the team navigate the school system and could sort of be that eyes on the ground saying, like, we need to be at this PTA meeting, or this is a constituent group within our schools that, you know, is really invested in this, or there was an incident and they need to debrief. So I think that position too will help, ideally help us navigate through the public school system as well, from the parent perspective.
That sounds great. And then the last question that I was wondering about, and you may not have the answer to this, but obviously there have been new executive orders put out by the new administration that have something to do with federal spending that has been authorized, and I was wondering if you have any sense if there's, again, this may not be something you have the answer to, but if you have any sense about whether those actions might impact these types of grants and the applications.
So we know that this notice of funding opportunity will get a reissued number. The initial due date was on February 14th. Now the new number will be released on the 18th, according to plan. We don't know if that has anything to do with the new administration necessarily, or if that will be delayed, but we're hopeful that it will go ahead as planned. We know that some Health and Human Services in particular has been impacted by a number of different executive orders around even communication with the outside world. So there's not much more information that we actually even know. Sadly.
And when you say a new number?
Yeah, so it's like a new grant opportunity number, like officially. So like also the requirements that go with the grant and other things that could potentially be shifted. And so we just don't know yet, but we're hopeful that will go ahead as planned.
I'm sorry, is there a new date that or we're not?
The opportunity number will be released, or the new opportunity will be released on February 18th. According to what that's, yeah.
If everything goes as planned, on February 18th, we'll find out the new due date and all that. Regardless, SAMHSA usually starts their grant funding on September 30th, and we expect it to be funded this year if it's funded. So I imagine it's going to be a quick turnaround after, if it's released on the 18th, probably a quick turnaround so that it could have the opportunity to be funded on September 30th.
So we'll be ready for it when it comes.
Mm-hmm.
Okay.
Is there anything you would want us to do if something drastic changes?
Well, yeah, I was just wondering for our process here, if you anticipate that the grant application changes in some way that like our approval does not carry through to the new application, or I'm not sure exactly how that might work, but if you anticipate that could be a problem, we could, I think, probably figure out how to maybe get an expedited approval process through the board. If it's like very similar to this application, we approve this, then maybe we can make sure we get an amended version through the process or something like that, if that's something that you anticipate. But
Okay, so I guess maybe what makes sense is after the new funding opportunity is published, we can just, with your permission, follow up with you and make sure that
Yeah, I mean, I think only if like the actual substance of the grant changes in some really meaningful way would we need to do anything different. As long as the description is the same, what our vote would still be enforced. So it's not tied to a date, it's not tied to a specific no vote or anything. Yeah.
Okay. Well, we would be happy to follow up once we know on February 18th.
Yeah, and we can talk to our staff also just to make sure that we're, dotting all our i's and crossing our t's, et cetera, in terms of the board's official role in approving these type of applications. But obviously we want to be supportive and things are in flux, so we will be happy to help out as much as we can.
Yeah, thank you, Chair. Appreciate the question too. I think it was on our minds.
I was just thinking, I mean, there's so many grants obviously that the city's applying for all the time that we've secured and things are up in the air. So glad that you're thinking about it and we will be in touch.
I have one additional
Yes,
question. If you, and I'm sorry if I missed this, why is the city the applicant on this? Is this only available to municipalities?
Only available to government and tribal organizations.
And so did the Yale team initiate it and brought it to us?
Okay, correct.
I don't have a question, I just have a comment, and I just want to say thank you. Because I work in mental health. And this sounds to me like a great missing piece to the puzzle. I work with the adults now, but I have worked with the youth. And somewhere there's something that's needed. So by the time they get to adult, it's already dealt with in some manner. So thank you.
Thank you. That's very kind of you. And I think that's true. So most of my I trained, I grew up here and then I trained here. And I agree with you. I think what ended up happening is, the people who do end up needing care for a first episode are sometimes difficult to engage with because they have already developed the illness and they're already suspicious of many people and it's hard to necessarily engage with them.
Right.
But if we get to them in the earlier phases, and even if they become suspicious or even if they become more symptomatic and ill, you've already established that relationship with them and they're more likely to kind of accept care.
Exactly.
I think it can make a big impact. Thank you.
I agree. Thank you.
Thank you, Alderman. Alder Singh has prompted me to have one more question, which is I was wondering if you have any plan to engage with Compass, our outreach team that works with folks all over the city in response to 911 calls.
Yes, absolutely. Elm City Compass is part of my portfolio in my office. So I'm luckily very connected to the team. Technically, the team serves adults. There would be some overlap in the 18 to 21-year-old specific residents, but certainly the team is out there, a trusted service provider in our community, and so I think there's lots of room for collaboration, and we can make sure that the players are connected to have those conversations. Thank you, Alder.
That's good to hear. Any other questions from colleagues? Seeing none, thank you for your presentation, and we would definitely love to be in touch about connections with the public schools and also about making sure we're all set with changing grant numbers and all of that.
Good luck.
Thank you. Yes, thank you for putting this together and taking the initiative to seek out this opportunity, which I think, as Alderman Grant was saying, could make a real big difference for folks in their community.
Thank you.
Thank you.
At this time, we will ask if there's anyone from the public wishing to testify on this item. And a second time, is there anybody from the public wishing to testify? And a third time, is there anybody from the public wishing to testify? Seeing none, do I hear a motion to close the public portion of the hearing?
So,
Hearing moved, do I have a second?
second.
Hearing moved and second. All in favor of closing the public portion of the hearing, please say aye.
Aye.
Any opposed? The public portion of the hearing is closed. Do I hear a motion?
Motion to adjourn.
We need to have a motion to move the item. Do I hear a motion to move item
So
one?
moved, Mr. Chair. So moved.
Hearing item moved, do I hear a second? Hearing item moved, sorry, item one has been moved and seconded. Discussion. I will just say that I'm in favor of moving this item forward to the full board. I'm very grateful to the city and the Prime team for putting this application together. I think it's a great opportunity to expand the services that are available to folks in our community, and appreciate also their perseverance as we deal with changing policy at the federal level, and we'll make sure that we work together to try to get this through, and hopefully we can bring these funds back so we can expand these services. So thank you for your work. Any other discussion? Seeing none, all in favor of moving item one, please say aye.
Aye.
Any opposed, any abstentions? The item is passed. Do I hear a motion to adjourn?
So moved.
Is there a second?
Second.
Hearing moved and second, all in favor of adjourning, please say aye.
Aye.
Any opposed, any abstentions? We are adjourned. Thank you all.